Top 10 effects of COVID vaccine. As reported by media internationally, the rollout of the COVID vaccine is just around the corner. Many people globally are concerned about the possible side effects. Although most people getting vaccinated may not experience severe consequences, some people may get mild to moderate reactions after receiving the COVID-19 vaccines. In this video, we bring you the top 10 effects of COVID vaccine. Number 1. Injection site pain, redness, tenderness, or swelling. After receiving any vaccination, many of us feel slightly sore in the arm for some time afterwards. Pain that occurs due to the vaccination is due to a muscle soreness where the vaccine is injected. Additionally, the pain also hints that our body's immune system is active and creates antibodies to fight off the virus recently injected. Possible remedies that exist require you to move your arm around after getting vaccinated to keep it working, may result in more pain, rubbing an ice pack on the injection site, taking pain-relieving medication for some days after getting vaccinated. And above all, consulting your physician if you continue to experience symptoms such as high fever, allergic reaction, redness, or swelling around the injection site, increases in size, or does not reduce even after 48 hours. Number 2. Mild temperature or fever. After receiving the vaccine, one may experience mild temperature. Thus, the recipient must regularly monitor their body temperature, experiencing a fever after vaccination. Vaccines prepare the immune system for the defense of humans from viruses and bacteria. The reason it occurs is by adding germ components known to stimulate the immune response. Conversely, the vaccine made to prevent the person's illness from causing a sufficiently severe immune response must consume extra fluids recommended by their doctor, including water and milk in large quantities. The recipient must try to keep cool by not overdressing, while cold water baths or showers for an extended time are not recommended. One more measure that can be undertaken is to rub lukewarm water sponge as much as possible. However, in some instances, the immune response is strong enough to cause symptoms such as mild fever. However, it is essential to note that the vaccine has not been successful if it lacks detectable fever or other side effects. Number 3. Headaches. According to the Center for Disease Control, CDC, and Federal Food and Drug Administration, FDA, headaches are among the most common symptoms reported by recipients after receiving a vaccine. The majority of headaches reported were unspecified types and reported to start immediately after 24 hours of completion in most cases. The possible remedies that may prove helpful are resting in a quiet, dark room, pressing a hot or cold pack around your head and neck, massages, and small amounts of caffeine. In case of any severe headache and related emergency, must seek professional help. Number 4. Fatigue. Research suggests that fatigue is another side effect reported by several COVID-19 vaccine recipients, especially young people who experience frequent and intense fatigue. The French National Health Research Institute virologist told French parliamentarians that these side effects are short-lived and when combined with a high level of protection, can tolerate them. She even went on comparing the side effects of the experiences of one encounters to any new job. The remedies that are reportedly helpful include drinking more water and less alcohol for better energy, reducing caffeine intake, sleep well, losing weight and eating often during the day to beat laziness, among many others. If an emergency occurs, one must contact their family physician as soon as possible and never shy away from getting help. If your fatigue does not improve correctly with rest or food, or if you suspect that it is due to a physical or medical disorder underlying this, see your doctor. You will help diagnose and work with you to treat your exhaustion. Number 5. Muscle, shoulder pain. Recipients of the vaccine experience severe and long-lasting muscle pain, a condition known as SIRVA. It results from incorrect placement of the vaccine in the shoulder bursa or shoulder joint instead of the deltoid muscle tissue. Its symptoms include chronic muscle pain after getting vaccinated, no such problem related to the shoulder before, and the shoulder's joints' limited mobility. Shoulder-administered vaccines are beneficial, and evidence indicates that vaccine advantages are much greater than the risk of these injections. However, complications can arise, such as chronic shoulder pain, caused by incorrectly administered injections. Ensuring that your doctor is adequately qualified in vaccination will help you not to get any complications. The remedies are known to help gently stretch the muscle, rest the body, and rub ice around the affected area to relieve pain. In case if the muscle/shoulder pain persists longer, one should immediately seek professional help. Number 6. Joint pain. People getting vaccinated with COVID-19 vaccine report joint pain. It refers to any pain, soreness, or discomfort in any type of the body joints. According to the American College of Medicine, people over 40 years of age are likely to experience joint pain due to COVID vaccination. The symptoms suffered by recipients of COVID-19 vaccination include swelling of the joint suddenly, the affected joint is completely immobile, and entirely the recipient is experiencing severe joint pain. Should seek doctor's help immediately if the pain lasts for more than 3 days. The area around the joint is red, tender, or warm to the touch. Possible solutions that can help in this regard are stretching before exercise, maintaining body weight in a healthy range, and doing moderate exercises to stay physically active. In either of the joints, joint pain leads to anxiety, aches, and soreness. The main complaint is joint pain. Usually a visit to the hospital is not required. Articular pain is often caused by disease or injury. The cause of joint pain is also normal. However, other circumstances or causes may also be contributing to it. Number 7. Chills. One more side effect reported by the COVID vaccine recipients are body chills, which, according to experts, indicate the body reacting to the vaccine or the virus already present in the body, which results in bodybuilding immunity against the virus. Remedies known to help relieve body chills include covering oneself with a light sheet of cloth, rubbing the body with lukewarm water, taking a cool shower, and above all, getting professional help when in case chills are accompanied by a high fever. You experience this as muscles expand and contract repeatedly, and the vessels in the skin become small. Fever can lead to chills and tears or trembling. You may have persistent body chills. The length of an episode can be 1 hour. Also, consistently and for many minutes, the chills will occur. Number 8. Nausea/vomiting. According to the information available regarding initial trials receiving COVID-19 vaccine report nausea, mostly the young who report symptoms such as weakness, unnecessary sweating, urge to vomit, and buildup of saliva in the mouth. Depending on the age, the reason for vomiting may vary. Vomiting from a viral infection or disease in which the child is experiencing a high fever is normal for infants. Remedies for nausea include resting, staying hydrated, eating bland foods, and avoiding fatty or spicy foods. Contacting a physician if nausea continues even after 3 days is recommended to start early treatments and relevant necessary measures. Vomiting is a common symptom but can still require emergency medical treatment. You can go to the doctor immediately if vomiting for over a day, the suspected headache is severe with a rough neck, extreme pain in the abdomen. If there is blood in the vomit, you should also pursue emergency care. Number 9. Mild rash. Moreover, one of the most commonly reported reactions to a vaccine is mild rash. It results from the human body coming into direct contact with a foreign substance, leading to itchy, red, or inflamed skin. Remedies good at getting rid of mild rash include using warm water instead of hot water and avoiding covering the inflammation with clothing, letting it breathe. Using soaps without any chemicals, and most important of all, is to contact a skin specialist if one feels increased pain or discoloration of rash area, difficulty in breathing, increased confusion, and dizziness. Number 10. Swollen lymph nodes. One more commonly reported reaction to a vaccine is swollen lymph nodes. It's the result of the immune system trying to build immunity in our body against the virus injected in it in the form of a vaccination. Lymph nodes can be found throughout your body in areas such as the armpits, under the jaw, and either side of the neck, and above the collarbone. Lymph node swelling occurs in response to illness, infection, or stress. Possible remedies useful in treating lymph nodes include antibiotics or antivirals as prescribed by your doctor. One other helpful therapy is to let swollen lymph nodes reduce on their own without any medication. With that being said, here we have come to the end of our video. I hope you liked this video. If so, then don't forget to subscribe to our channel so you never miss any video. See you in the next video. Till then, take care.